you ready to unravel the mysteries of fertility and embrace a path filled with hope? Join us as we delve into the intricate world of conception, addressing challenges head-on and illuminating pathways to parenthood. Whether you're just beginning your journey or seeking answers after a long road, our mission is to empower you with knowledge, support, and a personalized approach. Get ready to take the first step towards a brighter future. Your dreams of parenthood await. Step into a world where the desire for parenthood meets the labyrinth of challenges. Imagine a world where wanting to become parents meets a big puzzle of challenges. Meet John and Mari, a couple facing both hope and difficulties. As we uncover the puzzle pieces, some things are clear, while others are still unknown. It's like finding out about their health history and a childhood sickness that may have left a mark. Even the kind of work John does might play a role. But through all of this, there's a light of hope, a plan made just for them, guided by experts and their strong determination. Join us on this interesting journey, where facing tough times with courage shows that wanting to be parents can overcome many hurdles. Hello there, valued viewers, and a warm welcome to Eat Pray Lift channel. Our aim is to furnish you with up-to-date information about particular medical conditions, but it's crucial to emphasize that seeking guidance from your healthcare professional is essential for accurate diagnosis and care. Infertility is a common struggle faced by numerous couples, and I aim to bring understanding to this topic. My intention is to offer insight that could provide encouragement to those who are experiencing similar challenges, urging them to consider seeking medical assistance. As a fertility specialist, I'm here to assist couples like John and Mari who are navigating the intricate path of infertility. Understanding that their journey has extended for 2 years without conception, I recognize the importance of a thorough medical evaluation to identify potential underlying factors. Although both John and Mari maintain a healthy lifestyle, they are understandably concerned about the challenges they are facing in their journey to conceive. They have expressed a desire for a comprehensive explanation that delves into the reasons behind their fertility issues. Stay engaged, as I'll be sharing a wealth of valuable insights and knowledge throughout the entirety of this video. Your investment of time will be well worth it as we journey together through important information. Infertility is a condition where you can't get pregnant after 1 year of trying to conceive. Causes of infertility can include ovulatory disorders, endometriosis, low sperm count, or low testosterone. The risk of infertility increases as you age. Many treatment options are available for people with infertility. Symptoms and causes, diagnosis and tests, management, and learn about the connection between infertility and age. What is infertility? Infertility is a condition of your reproductive system that causes people to be unable to get pregnant. Infertility can affect anyone and has many causes. Getting pregnant involves several steps. Your brain must produce reproductive hormones that control ovarian function. An egg must mature in your ovary. Your ovary must release an egg, ovulation. Your fallopian tube must pick up the egg. Sperm must travel up your vagina and through the uterus to your fallopian tube. The sperm fertilizes the egg to create an embryo. The embryo travels through your fallopian tube to the uterus where it implants. A pregnancy can't occur if anything in this process doesn't happen. If you're younger than 35, your healthcare provider may diagnose infertility after 1 year, 12 months, of trying to conceive. Trying to conceive is defined as having regular, unprotected sex. If you're 35 or older, your provider may diagnose infertility after 6 months of regular, unprotected sex. Infertility is more common than you might think. Fortunately, there are many treatment options available for people who wish to begin or expand their family. Types of infertility include primary infertility. You've never been pregnant and can't conceive after 1 year of regular, unprotected sexual intercourse. Secondary infertility. You can't get pregnant again after having at least one successful pregnancy. Unexplained infertility. Fertility testing hasn't found a reason that a person or couple is unable to get pregnant. Infertility is very common. In the United States, 1 in 5 women between 15 and 49 years old struggle with primary infertility, and about 1 in 20 women struggle with secondary infertility. Approximately 48 million couples live with infertility around the world. The main sign of infertility is being unable to get pregnant 1 year of regular, unprotected sex. You may not have any other symptoms, but some people may show physical symptoms such as pelvic or abdominal pain, irregular vaginal bleeding, irregular periods or no periods, penile disorders or issues with ejaculation. There are many causes of infertility, and sometimes, there isn't a simple answer as to why you're not getting pregnant. Only a healthcare provider can determine the cause and find the best treatment for you. While causes of infertility vary, studies show that 33% of infertility involves the partner with a uterus and ovaries. 33% of infertility involves the partner with a penis and testicles. 33% of infertility involves both partners or is unexplained. 25% of infertile couples have more than one factor that contributes to their infertility. Some causes of infertility affect just one partner, while others affect both partners. Risk factors for infertility include age, particularly being in your late 30s or 40s. For men, age begins affecting fertility closer to 50. Eating disorders, including anorexia nervosa and bulimia. Excessive alcohol consumption. Exposure to environmental toxins, such as chemicals, lead, and pesticides. Overexercising. Radiation therapy or chemotherapy. Sexually transmitted infections. Smoking and using tobacco products. This behavior plays a role in about 13% to 15% of infertility cases. Substance abuse. Having obesity or being underweight. Chronic conditions and diseases. Ovulation disorders are the most common cause of infertility in people with ovaries. Ovulation is the process in which your ovary releases an egg to meet sperm for fertilization. These factors can contribute to female infertility, endometriosis, structural abnormalities of your vagina, uterus, or fallopian tubes, autoimmune conditions like celiac disease or lupus, kidney disease, pelvic inflammatory disease, PID, hypothalamic and pituitary gland disorders, polycystic ovary syndrome, PCOS, primary ovarian insufficiency or poor egg quality, sickle cell anemia, uterine fibroids or uterine polyps, thyroid disease, prior surgical sterilization, tubal ligation or salpingectomy, genetic or chromosomal disorders, sexual dysfunction. The most common cause of male infertility involves problems with the shape, movement, motility or amount, low sperm count. Other causes of male infertility include enlarged veins, varicocele in your scrotum, the sac that holds your testicles, genetic disorders, such as cystic fibrosis, high heat exposure to your testicles from tight clothing, frequent use of hot tubs and saunas, and holding laptops or heating pads on or near your testes, injury to your scrotum or testicles, low testosterone, hypogonadism, misuse of anabolic steroids, sexual dysfunction, such as erectile dysfunction, anejaculation, premature ejaculation or retrograde ejaculation, undescended testicles, previous chemotherapy or radiation therapy, surgical or congenital absence of testes, prior surgical sterilization, vasectomy. Mira showed her concerns. How is female infertility diagnosed? First, I will get your full medical and sexual history. These tests can also help diagnose or rule out problems. Pelvic exam. Your provider will perform a pelvic exam to check for structural problems or signs of disease. Blood test. A blood test can check hormone levels to see if hormonal imbalance is a factor or if you're ovulating. Transvaginal ultrasound. Your provider inserts an ultrasound wand into your vagina to look for issues with your reproductive system. Hysteroscopy. Your provider inserts a thin, lighted tube, hysteroscope into your vagina to examine your uterus. Sonohysterosalpingogram, HSG. Your provider fills your fallopian tubes with saline and air bubbles during an SIS procedure to check for tubal blockages. X-ray hysterosalpingogram, HSG. X-rays capture an injectable dye as it travels through your fallopian tubes. This test looks for blockages. Laparoscopy. Your provider inserts a laparoscope, thin tube with a camera, into a small abdominal incision. It helps identify problems like endometriosis, uterine fibroids, and scar tissue. John showed his concerns. How is male infertility diagnosed? Diagnosing infertility in people with a penis typically involves making sure a person ejaculates healthy sperm. Most fertility tests look for problems with sperm. These tests can help diagnose or rule out problems. Semen analysis. This test checks for low sperm count and poor sperm mobility. Blood test. A blood test can check thyroid and other hormone levels. Genetic blood tests look for chromosomal abnormalities. Scrotal ultrasound. An ultrasound of your scrotum identifies varicoceles or other testicular problems. How is infertility treated? Treatment for infertility depends mostly on the cause and your goals. Your age, how long you've been trying to conceive, and your personal preferences are factors in deciding on a treatment. Sometimes, one person needs treatment, but other times, treatment involves both partners. In most cases, people and couples with infertility have a high chance of pregnancy. Things like medication, surgery, or assisted reproductive technology, ART, can help. Often, lifestyle changes or improving the frequency and timing of intercourse can improve your chances of pregnancy. Treatment can also include a combination of methods. Infertility treatment for women starts with lifestyle modification, gaining or losing weight, stopping smoking or using drugs, and improving other health conditions can improve your chance of pregnancy. Medications. Fertility drugs stimulate your ovaries to ovulate more eggs, which increases your chance of getting pregnant. Surgery. Surgery can open blocked fallopian tubes and remove polyps, fibroids, or scar tissue. Providers may make suggestions on how you can improve your odds of conceiving. These may include things like tracking ovulation through basal body temperature, using a fertility tracking app, and noting the texture of your cervical mucus. Using a home ovulation kit, a kit you can purchase at the drugstore or online to help predict ovulation. Treatments for infertility and male medications. Medications can raise testosterone or other hormone levels. There are also drugs for erectile dysfunction to help you maintain an erection during sex. Surgery. Some men need surgery to open blockages in the tubes that carry sperm or to repair structural problems. Varicocele surgery can make sperm healthier and improve the odds of conception. What are common fertility treatments? Some couples need more help conceiving using assisted reproductive technology, ART. It is any fertility treatment that involves a healthcare provider handling the sperm or egg. To increase pregnancy odds, you can take medications to stimulate ovulation before trying one of these options. In vitro fertilization (IVF). It involves retrieving eggs from your ovary, then placing them with sperm in a lab dish. The sperm fertilizes the eggs. A provider transfers 1 to 3 of the fertilized eggs' embryos into your uterus. Intracytoplasmic sperm injection (ICSI). This procedure may be performed during the IVF process. An embryologist injects a single sperm directly into each egg. Then, a provider transfers 1 to 3 of the embryos into your uterus. Intrauterine insemination. A healthcare provider uses a long, thin tube to place sperm directly into your uterus. IUI is sometimes called artificial insemination. Third-party ART. Couples may use donor eggs, donor sperm, or donor embryos. Some couples need a gestational carrier or